I'm Dr. Michael DeTola.
And I'm Megan Strong.
Ever wish your toothpaste were brown?
Or wish that your toothbrush could turn into a Tootsie Roll?
If so, a company in New Orleans has been reading your diary. That and more on today's Chairside Live. Hello and welcome to episode 40 of Chairside Live. Megan, how are you today?
I'm doing well. How are you?
I'm doing fantastic. Thank you for asking. We've got an interesting case of the week to share with you today. It's a doctor who sent us a case, and as you'll see, it looks like a little more planning on the front end might have made this case a little bit easier to get through. It's one of the larger cases we received in the lab, and not in terms of physical size, but I'll tell you what, let's take a look at it and you'll understand what I mean. I was walking through the fix department the other day and I saw this case, and it looked just a little odd in the box, so I had to take a little closer look at it to see what was going on. And I'm not, I don't want to sound like I don't feel sorry for the doctor here, because I know that this had to be a frustrating case when you look what we received here, and you look at all the different impressions that this doctor took. So we've got two full arch impressions, and then we've got three quadrant impressions, and it's actually a good size case. He's got 8 units here that he's prepared, as we'll see when we look a little closer at the models. But just to look at the impressions first, and maybe the reasons why there needed to be so many impressions. I'm okay with a tray like this, a stock plastic tray. I use all custom trays, but I cheat a little bit because I'm practicing inside the laboratory. I realize if you could snap your fingers and get a free custom tray like I do, I don't pay for them, that you would do it as well. So all I can tell you is that I get good results. Some dentists will take the next step and make them in their own office or actually ask for them, but when I was out in private practice, I was using trays like this all the time. And as long as they fit well, and this one appears to, great, no big deal. But I noticed that there really doesn't seem to be a lot of retraction going on. As we zoom in a little bit and look at some of these margins of these impressions up close, hopefully I know I do at my lectures, I really try to have dentists kind of drill into their mind what an ideal impression will look like. In fact, we'll throw up a picture of one right here so you can see what an ideal impression looks like. And what it looks like is it's got material, a fin of material beyond the margin. We have to be able to see some material beyond the margin, and if the end of the impression is right at the margin, that is not going to be adequate. And so when I look at this, I notice that. I also notice just the one viscosity of material. I don't think that's that big of a deal if you pack cord. I use that 2-cord technique, and frankly, I think one viscosity, I think I could get decent results with just heavy body with that 2-cord technique, because you have a huge sulcus that you could drop your car keys into. And again, that's not skill on my part. If anything, it's discipline. It's the discipline of doing the 2-cord technique, and it's letting my assistant, get in, hop in, and do some of the cord packing, which she's allowed to do in California. But when you have a sulcus that open and that wide, there's no doubt you're going to be able to just get any impression material in there. If you're going to use something without retraction, that's when you're going to want to use, an extra light body. Not that I even believe that works. I really don't think there's any material that's thin enough, and I don't think you can generate enough force with this heavy body stuff to push impression material subgingival, to push the tissue away from the tooth and really to be able to get in there. I think you need a clean, dry sulcus. Most of these materials are hydrophobic unless they're polyether, and this might be a polyether. But I still don't think you can generate enough pressure to really get it down there compared to that 2-cord technique. I've tried it. I've tried the different techniques. Frankly, looking for shortcuts, looking for an easier way to do it, and haven't seen them. So those are kind of the impressions, and 5 of them I know is super frustrating for that doctor to have to do. Also not a big fan of wax bites. This doctor is in the eastern United States, and so these were flown across the country, and we definitely see distortion. Now, he did make it nice and thick. I appreciate the fact that they're nice and thick, because they're much less likely to distort when they're thick like this. It's when we have one single sheet that it's a little difficult to do, but the patient sometimes has a hard time closing into this thicker wax. So if you're going to do a wax bite, this is the way to do it. You can see how many sheets are rolled all the way around there. But we feel much better with something like a Blue Moose, a very stiff polyvinyl siloxane, or my favorite, the Luxabite, which is actually a bisacryl, like a tempering material, and that you can hit with a hammer and it won't break. So we're always a little bit worried about the wax distorting, especially when we have 8 preps, and that gives us fewer teeth to be able to hand articulate the models with. So, but we were able to mount the models, and when we look at the mounting itself, it appears that it is correct. As we look at how everything lines up here, we feel like, yeah, that's pretty close. But it would be nice if we could have something a little harder, like a bisacryl material. So now let's take a look at some of the preparations here, since we've seen the impressions, and see if we see any signs of tissue retraction. And you can see some signs of where we went in and tried to trim stuff, looking for some of the margins. That's a burr mark. But when we're looking, or even over on this side, for signs of retraction, signs of a wide open sulcus where we could get material beyond the margin, we don't see a lot of that. And by the way, these marks, I'm sure you know as well as I do what those are from. Those are from removing the old crowns that were in place. And I only point this out because this is something that is kind of a big deal for Bruxer when you're removing Bruxer. And the doctor actually has requested Bruxer crowns here. And when you're cutting through Bruxer, you want to make sure that you've got some zirconia optimized burrs. We sell some here. Axis has some burrs, and so does Brasseler. You just want to make sure you're using zirconia optimized burrs, and you want to make sure you're not putting a lot of pressure down on here. In fact, I usually start over here at the junction of the buccal and the occlusal, and I'll take the middle third of my burr. Let's just pretend this perioprobe's a burr. And I'll take it, the middle third of the burr. I won't use the tip, and I won't go to the gingival. I just start right here at the thick part of the crown, and I just go back and forth like this. In fact, we have a video online of me cutting off a Bruxer crown. I go back and forth until I expose a little piece of the tooth, a little section of the tooth through the crown. So I just keep going back and forth, taking it off till I can see that little piece of tooth. And once you've established the depth of the tooth, then I kind of start to unzip it. And so I'll go from that spot and start rolling it up, because now I know I'm down to my depth. And so I keep rolling it until I can see tooth structure, and then I roll it down this way and start pushing it towards the gingival, pushing the tip of the burr down as it's moving once I've exposed the tooth. Because otherwise, if you just lean on the Bruxer and try to cut through it, as you cut through it, it's such a stiff material that as you fall through the Bruxer, you could go into the tooth and leave grooves like that, and we try not to do that. It still happens from time to time, regardless of what you're cutting off. I always turn to my assistant and I say, I've decided to place an anti-rotational groove in the tooth. And she looks at me like, no, you didn't. You just kind of lost control of what you were doing. But how is she going to prove it? She doesn't know what's going on in my mind. And then we look here as well, and again, you can see, some separation in a spot or two where maybe there was cord, but you can see there what looks to be tissue that's been coagulated with an astringent. So we can kind of see the margin most of the way around on those two teeth, and then it gets a little sketchier here on some of these preparations on the upper teeth as well. And so if we look together to see how we did in terms of reduction, well, that's plenty. That is plenty for Bruxer. That's actually enough for Emax as well. So that's a great job on reduction done by this doctor. And yeah, that's 1.5 millimeters, 2 millimeters, and 1.5 millimeters there. So that's plenty for Bruxer. Those restorations will last a good long time. And then, of course, we have a ton here where these two teeth were prepped, and Bruxer's fine with that. And we have enough on the tube eyes. Little tight here. Obviously, to me, this is out of my comfort zone for Emax on a tooth like this. But Bruxer, we've got close to 1 millimeter here, and maybe a little less. But Bruxer will do fine at anything thicker than, I like to say, 0.6 millimeters. Most of our advertisements will say 0.5. I say 0.6 because I have a 0.6 millimeter depth cutter on my burr kit, so I can accurately establish what 0.6 millimeters of reduction actually looks like. So great job done on the occlusal reduction there, and considering that's the #1 problem that we see in the laboratory, it's really nice to see a doctor, prep 8 teeth and have enough reduction on all of them. So if anything, to me, as I look back at this case, and we're going to need a couple more new impressions to get started here so we can clearly see the margin. To me, this comes really down more to the impressions itself. The preps, the occlusal reduction, nothing wrong with those. Those are all going to work when we can see the margins. And if you hate packing cord, I get that. It's not fun. I always pack the first cord. I pack the 00, then my assistant puts the 2 cord on top of that when I'm out of the room. But if you don't like packing cord, I get it. I understand it. And especially on a case like this where all the teeth are posterior teeth. But that's a perfect time to hop in with a diode laser. And now you look at something like the Picasso light from AMD Lasers. It's just barely over $2,000. And you can just go in with that laser and just take that diode laser and just zip around the teeth and trough those teeth. It removes some tissue while you do it, but that's really not a big price to pay in the posterior. When it comes to anterior teeth, I'm much more hesitant to use laser troughing in the anterior, because as you go in, this tissue is so thin right along here that as you go into trough in that area, you actually lose some height, and I re-expose my margin again. But teeth like this, like these 3 teeth and these 3 preps over here, just grab that diode and go in there and just remove that tissue. As soon as you remove that tissue, it looks like you were using the 2 cord technique, because you've got a wide open sulcus where you almost can't help but get a great impression. So I get not wanting to pack cord, but if you don't pack cord, you got to hop in there with a diode laser and do something, because just trying to force 1 viscosity of material, or even 2 viscosities of material, even if there was some extra light body in here, it's just difficult to force it down into a wet sulcus with a hydrophobic material. So got no problem avoiding the cord, but you're going to want to grab that diode laser. And really, as soon as this tissue's cleared up from around these teeth and we get a good impression, this is going to be a great case for this doctor, because the preparation looks really nice. So again, only critiques here would be on the impression technique itself and the bite registration. Even though it appears to work here, if you're using a distance laboratory, which would be anybody you're sending it to, whether they're on the other side of the state or the other side of the country, I feel a lot more confident with the more stable Luxa Bite, or you could certainly use the Blue Moose material as well. So hopefully when we get the new impression back from the doctor, we'll be able to see all those margins very clearly, and we can go ahead and help this doctor and this patient end up with a successful case.
Thank you for that, Dr. D. Now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us all the way from South Africa from Dr. Naeem Valley, and he writes, "Hi Dr. Datola. I am a dentist from South Africa using Bruxer crowns. I have watched your demo video and I would like to know your thoughts on using Reliax self-adhesive resin cement with these crowns. Regards, Dr. Naeem Valley."
Well, thank you for writing to us all the way from South Africa. That's amazing. And we actually do have a dealer in South Africa who actually sells Bruxer, so I know in fact that he's telling the truth. I just got an email from a dentist the other day in Egypt who works at a dental school there, one of the professors, and he wants to start doing Bruxer in Egypt. So that's one of the neat things about Bruxers. We have over 200 laboratories that are officially able to make Bruxer crowns all over the world, most of them here in the U.S., but it's neat to hear that you've got it down there. And you ask a great question. The Reliax cement that you refer to, we call in the States Reliax Unisem, and it's a self-adhering resin cement, meaning that the self-etch properties are actually incorporated into the cement itself. Now, the one thing you have to watch out for when using this with Bruxer is because of the fact that the Reliax Unisem is hydrophobic, like most resin cements, it does not like moisture at all. But when you look at the zirconia oxide on a Bruxer crown, it's hydrophilic. It loves moisture. So we need something to go between the two. And the best 2 choices are going to be Z Prime Plus from Bisco or Monobond Plus from Ivoclar Vivadent. Both of these products are zirconia primers. They're really not silanes like we typically think of one, even though they do the same thing. They're going to help the cement bond to the crown. Now, the other thing that's tricky about Bruxer is that it will be contaminated by saliva when you try it in intraorally. And so the phosphates that are in the saliva are going to bind to the zirconia oxide in the inside of the crown. And we need to get those off so that the phosphates in the Z Prime Plus or the ones in the Monobond Plus can actually bond to the inside of the crown. So you're going to want to use a product called IvoClean from Ivoclar Vivadent. And that's going to get all those phosphates out of the inside of the Bruxer crown, giving you a fresh surface to put the Z Prime Plus or the Monobond Plus into the crown. Then you're going to hit it with warm air after 30 seconds, and then you can put your Reliax Unisem into the crown and place it down onto the tooth. Now, that all sounds like a lot to do, and some people see that it is. You could also go with a cement called Ceramir, Ceramir, from Doxa, a Swedish company. And this also works very well with Bruxer, but it's got a different way that it bonds to the Bruxer crown. It doesn't use phosphates. It has to do with the fact that it's a hydrophilic cement that forms these nanocrystals. And in other words, you can try a Bruxer crown and take it out. There's no need for Ivoclean. There's no need for the zirconia primers like the Z Prime Plus or the Monobond Plus. You can just try the crown in, take it out, rinse it out like you would normally do, and then go right to the Ceramir and use that. I'm just not sure if it's available yet in South Africa. It's available here in the States, and it's flying off the shelves because so many doctors are doing Bruxer, and they like the idea of not having to use the Ivoclean and one of those zirconia primers at the same time. So Ceramir has been a big success for us. And for me, it's gone from being something that I use just on Bruxer to my everyday cement that I now use with Emax crowns, and I now use with the PFM bridges that I do as well. So thank you so much for writing in all the way from South Africa. And Megan, as our first international viewer mail. This is pretty momentous. I'm sure you've got something special
I got a
for
trick
somebody
up my
watching
sleeve.
all the way from South Africa.
An autographed
But no,
photo.
exactly the same photo that everybody else gets. You'd think, writing from so far away, that we would do a little more for him.
I think this is enough. I think this is more than enough. Look at this.
Yeah, I feel like it's not. I feel like it's about a third of what the total compensation package should be for that viewer mail, but
We'll work on it.
all right, we'll work on it, and maybe we'll get an international version. We can put us maybe in some costumes.
Right, that would
Photoshop
be
some
nice.
Costumes on and
Flags
and
from
send it
around
down
the
to you.
world.
We'll go to an IHOP and take a picture, perhaps. That's very international.
Okay.
That's as close as we get here at Chairside Live. Well, Megan, thank you for that. Is there anything in the news?
Yes. If you're tired of the same old mint toothpaste, how does chocolate toothpaste sound? Theoden is the brand behind this new chocolate toothpaste that claims to strengthen teeth and regenerate enamel without using fluoride. The paste contains Renew, a proprietary blend of cocoa extract and other minerals that work together to strengthen teeth and is said to be more effective than fluoride. Renew was discovered 30 years ago, and researchers have been studying it and working to release it into the marketplace. The toothpaste is currently available online and at the grocery store Whole Foods for about $10.
Well, I can't say that I'm bored to tears with mint toothpaste.
Right.
It's not something I give a lot of thought to. But if you asked me to sit down and come up with the 3 flavors that I'd want in a toothpaste, liver and onions, of course.
So gross.
Chocolate.
Sure.
And foie gras. But now that it's illegal in California. But does that strike you as delicious?
Well, see, here's the thing, is that right when you hear the story, you think, okay, it's chocolate-flavored toothpaste, but it is not. And even the packaging is quite deceiving because on the front of the package, it makes it look like a chocolate candy bar wrapper.
Right.
But it actually does not taste like chocolate. It's still, I guess there's like a little bit of a different taste, but it's mostly still mint. But it's the cocoa extract in it is why it's a chocolate toothpaste.
So it's kind of like Russell Stover's, where it looks like chocolate,
but
tastes
it's
like
really
wax.
not.
Right.
Right.
Okay. It's not Godiva, is what you're saying.
So the reason why they call it chocolate toothpaste is because the cocoa extract that they use in the blend of the Renew is from obviously cocoa. So that's why they call it chocolate toothpaste. But essentially, it's not going to be like brushing your teeth with a Snickers.
Right. That's too bad. And what's up with Renew? That reminds me of Certs, now with Retsin. It was like, I don't know what Retsin is, but I want some. I'm not sure there's enough Retsin in there for me. That's how much Retsin I need.
And it's interesting that they're saying now, fluoride has been the number one, ingredient in there to fight the decay and stuff. They're saying that now it's going to be this chocolate extract? I don't know.
Well, I will agree with them on this. Just fluoride and fluoridation, those words alone, they're so loaded, unfortunately, where people hear it and they're like, no, I don't want any fluoride, I don't want this, I don't want that, you can't put it in our water, which is unfortunate because we see the decay rates, going up in kids. I think you might have a news story on that.
Yeah.
And it's really sad to see that parents are afraid of fluoride, and they shouldn't be. So if there is something, even though it's called Renew and it's not fluoride, that's going to be significant and people are going to use it, then I'm all for it.
Sure.
Anything else, Megan?
Yes. A new report from the Minnesota Department of Health, the MDH, shows that 55% of third graders in the state have experienced tooth decay. Among the students, low-income children have the highest rates of poor oral health. Children eligible for free or reduced lunch were almost 1.5 times more likely to experience tooth decay and almost 3 times more likely to have the decay go untreated than their more affluent peers. The MDH put together an oral health plan to help improve dental health throughout the state.
Well, that's really unfortunate. That's a high percentage
Right.
of third graders. And I was just reading another report that the overall decay in kids, not just in Minnesota and not just in the lower socioeconomic strata, but all kids was still going up. And a lot of it has to do with bottled water, with parents not wanting to have their kids drink tap water, which when I was growing up was no big deal. You'd be out playing outside, you just grab the garden hose, you drink out of
Sure.
it. Nobody would run out and scream like you're about to commit suicide. And so by drinking bottled water, which has no fluoride, as opposed to drinking tap water, which in most major metropolitan areas is 1 part per million fluoride, it's going up anyway. But to see this happen in the school like that is really tragic. To see
Sure.
third graders, over 55% of them have this kind of decay.
Right, and I mean, we know that our Coca-Cola and soda consumption is at an all-time high,
Right.
and especially in children, and so I think that probably contributes to the problem as well. And so if we can, I'm not sure exactly what the health department's plan is for their oral health plan, but I'm hoping that it is pushing more water and less sugar-based drinks to help combat it as well.
And about 2 weeks ago, Rella Christensen, the wife of Gordon, who we had obviously on here and interviewed her, and we should have interviewed Rella. Note to self, next time Rella's in the building, interview her. She was talking, in fact, she was down here because she wants us as a laboratory to create buccal veneers. And so they're going to look like, kind of like porcelain veneers that you
Right.
put on front teeth, except they're going to go on the first and second molars of children, when they get their first molar, and then
Right.
their 12-year molar when they get that. And they get bonded to the outside of the teeth, and they basically dissolve, releasing something sort of like a calcium hydroxide solution that is basic in pH. And so all the bacteria that cause tooth decay are acidogenic. They like living in an acid
Sure.
environment, and they produce acid, and when enough of them do that, it eats a hole through the enamel, and like these Minnesota
Right.
kids, they get cavities. And so we know that if you can keep the pH of the mouth slightly basic and not acidic, that kids won't get decay. So Rella was
Wow.
down here working with us, hoping that we can come up with some sort of veneer where dentists just could put these on the kids' molars and be able to stop a problem exactly like that.
That'd be great.
That would. That'd be an incredible legacy to be able to leave, especially for the kids who can't afford to go to the dentist on
Right.
a regular basis. A dentist could go into the school and put these veneers on at the school without them having to go to a dental office.
Definitely.
Good stuff. Hopefully it'll work. Well, that about wraps up for this week's edition of Chairside Live. On behalf of myself, Megan, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. I've watched your demo video, and I would like to know your thoughts on using Reliax. Why did I say that so weird? Reliax.
You ever wished your toothpaste was brown? You ever wished your toothbrush would turn into a tooth? That's going to be a tough one.
Tuna toothbrush.
Good name for a band.
I've watched your demo video, and I would like to know your thoughts on using Reliax 3M. I was going too fast anyway. This week's viewer mail comes to us. It's about starting over. That's not even what I wanted to say. Okay.